Good morning, good afternoon, everyone. I'd like to welcome you to our first segment of the CFIA's webinar series titled, Are You Ready to Detect and Respond to African Swine Fever? The topic for today is a disease overview and recognition of African swine fever. My name is Dr. Egan Brockhoff. I'm a swine veterinarian with Prairie Swine Health Services in Red Deer, Alberta, and I teach swine medicine at the University of Calgary, Faculty of Veterinary Medicine. And for the past 6 years, I've been the veterinary counselor as well for the Canadian Pork Council. Very exciting topic today. African swine fever is certainly on many people's minds throughout the world. A few housekeeping notes as we get our day underway. This is going to be a 60-minute lecture. We will do questions following the session as time permits. And I'd ask everyone if they could to put their questions into the chat function, which you can hover over and type in. Our presenter today is Dr. Amy Snow. She is the National Manager at the CFIA and someone I've been working very closely with on African swine fever for the past few years. Dr. Snow holds a doctorate in veterinary medicine and a Bachelor of Science degree from the University of Guelph. She has worked at the Canadian Food Inspection Agency since December 2009. Prior to joining the CFIA, Dr. Snow worked for 7 years in small animal private practice. She began her work at the CFIA in the Animal Import and Export Division, where her focus was on the importation of live animal commodities. He is currently National Manager of the Foreign Animal Disease Section of the Animal Health, Welfare and Biosecurity Division of the CFIA. However, since December 2018, she's been working exclusively on African swine fever, acting as the planning chief for the National Emergency Operations Center. In this role, she has had the opportunity for extensive stakeholder collaboration, which she has enjoyed immensely. Amy lives in rural Ottawa with her husband and kids and various pets, and enjoys a very active lifestyle outside hiking, biking, and cottaging. So please allow me to welcome Amy Snow.
All right, thank you so much for that introduction, Egan, and thank you for moderating this session. I know you're incredibly busy working on various ASF files as well as other work in swine private practice, but I think your expertise and knowledge will be a great asset to these discussions. I also wanted to thank all the participants that have joined us today. We hear the numbers are quite high, and we really appreciate people taking the time out to join us for this really important discussion. And we've been working on these webinars now for some time, so it's really nice to see them come to fruition and have a lot of interest in what we're presenting. I also wanted to thank the CVMA for supporting this initiative, as well as Drs. Bobby Lundquist and Sonia Laurando for their role in co-developing the materials and also co-presenting. So just going to get started here. So as Egan mentioned, this is the first of a 3-part ASF presentation series. And the content of this presentation provides a high-level overview of ASF, why it's a concern for the Canadian swine industry, and also reviews disease information and recognition. This presentation is intended to be an awareness session, not only for swine vets, but also vets who may only occasionally see swine and may not be as familiar with ASF. I also wanted to let people know that there is other initiatives in place to consider the development of other learning tools that could be made available for veterinarians to further the collective awareness of ASF. So first we'll review ASF in the international context and why it's a concern for the Canadian swine industry. So I think as most people know, African swine fever is a contagious viral disease that only affects pigs. ASF is not zoonotic and does not pose a food safety risk to people. Currently, there is no treatment or vaccine available for ASF, although numerous vaccines are being attempted and remain in development. The disease is continuing to spread globally in hog populations, and this increases the risk to Canada as the global viral load increases. It has never been reported in Canada, or North America for that matter, but Canada is taking actions to both prevent disease introduction and increase preparedness should the disease be introduced. So the map on this slide shows the global ASF situation between the years of 2016 and 2020. And just a note regarding the maps, we tried very hard to include the most up-to-date maps, but it was not always possible given ongoing changes to the global distribution. So if people are looking for resources for maps after this presentation, I would recommend using the OIE, or the World Organization for Animal Health, or FAO resources, as they tend to be the most reliable and the most up-to-date. So if we look at the current occurrences of ASF, it does continue to spread globally. Since its initial report in China in August of 2018, the virus has now been identified in wild or domestic pigs in 19 new countries. So in Europe, that includes Bulgaria, Belgium, Slovakia, Serbia, Greece, and most recently, Germany. In the Asia-Pacific region, that includes Mongolia, Vietnam, Cambodia, Hong Kong, North and South Korea, Laos, the Philippines, Myanmar, East Timor, Indonesia, Papua New Guinea, and India. And it should be noted that while outbreaks in Europe are primarily due to wild boar, in China and other parts of Asia, spread has been primarily human-mediated, sometimes over very long distances, and in many cases are due to practices such as garbage feeding and a lack of strong biosecurity practices. So looking closer at the disease outbreak situation in Asia, the map on this slide demonstrates the current situation. So ASF continues to spread throughout China, Southeast Asia, and Eastern Europe. We've had situations recently, such as in South Korea, where they had gone quite an extended period of time, I think almost a year, without reporting cases in domestic pigs. And now recently they've seen additional cases being identified, which is really discouraging from that international perspective. The outbreak in China has resulted in varying numbers of pigs being reported as culled. And it ranges pretty significantly from what is officially declared as culled to what is reported as unofficial numbers in China. So in terms of sort of consistent reporting, what we do know is about half of the world's pigs live in China, and it's consistently reported that about half of the Chinese pig population has been culled as a result of ASF. So we're looking at about a quarter of the world's pig population being affected by this current outbreak, which is probably 200 million pigs or more that have been affected. Now, obviously, there's significant losses in other countries as well and significant impacts, but in terms of numbers, the impact has been greatest in China. While ASF has been historically present in certain areas of the world, such as Africa, the current outbreak is notable due to the rapid spread internationally across Asia and into several EU countries. Still, all of this is going on across oceans and in places far from Canada. So why are we concerned? Canada is the third largest exporter of pork in the world, with the Canadian pork industry being worth 24 billion Canadian dollars. Canada exports 70% of its hog production, which includes live pigs, germplasm, and pork products. The top 5 export markets for Canada include the USA, Japan, China, Mexico, and South Korea. And in 2018, Canada produced 2.1 million tons of pork products, with 1.3 million tons of this being exported to 87 countries, valued at $3.8 billion. The significance of this export dependency is that one positive case in ASF in Canada would stop all hog and pork product exports immediately, causing the following outcomes: market closures and significant economic impacts, significant reduction in the value of hogs and revenue to producers, millions of hogs and pork products with no market. And to consider the scale of the impact of ASF, even if domestic production entirely replaced what we currently import, Canada would still have a surplus of 50% of our current production. There would be significant animal welfare concerns, likely within a week. And the CFIA would be implementing immediate disease response activities, including zoning, tracing, surveillance, and depopulation. And it's important to note that diseased animals would only be a very small proportion of the cull of swine. A far greater number would need to be culled for welfare purposes due to the loss of export markets. So where are Canada's pigs? This slide demonstrates where the majority of Canada's swine population exists for the commercial industry. And the numbers in the circles relate to the number of commercial farms. And I'll just point out that we do not have information for Newfoundland due to confidentiality issues, and there was no data available for the 3 territories. So Canada's swine industry has over 7,000 pig farms that in 2019 produced 26.8 million hogs. At any given time, there are approximately 12.6 million hogs in production, which is 25 weeks worth of production. And this number is based on the inventory of all pigs on farm at some stage of production. And the main significance of this number, the 12.6 million, is it demonstrates that the production cannot just simply be turned off quickly. The pigs in the system have to move through before things can begin to be slowed down. In the commercial sector, there are 3 provinces that are heavily implicated in swine production, and these are shown in yellow, so Manitoba, Ontario, and Quebec. However, there are commercial swine holdings all across Canada, and therefore any diagnosis of ASF in any swine, wild or domestic, in any province would be significant and have the same immediate implications. Commercial populations are generally more biosecure, so for example, the pigs are raised indoors, but the risks these populations pose are related to extensive movements that occur, sometimes crossing several provinces. If there is a delay in ASF detection, the disease may have been inadvertently spread extensively. So this slide demonstrates the pig populations in small holdings. And again, the numbers in the circles relate to the number of farms. And both commercial and smallholder type operations are considered to be part of the domestic pig population. For international purposes, there is no specific commercial population. It's either domestic or wild. So just a question to consider. Why do you think small holding operations pose a greater risk of ASF? So in general, backyard or small holdings tend to raise animals outdoors, which may result in spread to wild pig populations if ASF was to be present in Canada. Or reciprocally, wild pigs could also spread the disease into this population. As such, we are especially concerned about small holdings present in areas where wild pigs are also present. Small operations may also be more likely to participate in activities such as alternative sources of feed, so feeding of waste, which may also pose a risk for disease transmission, and are also less likely to have regular vet oversight. So now we're going to switch gears a little bit and focus on ASF, the disease. So ASF is caused by a DNA virus of the Asparviridae family. It is the only known DNA arbovirus. Many features of this virus are common to both pox virus and iridovirus families. It is a large, so 20 nanometer diameter, complex, enveloped double-stranded DNA virus. There is only one recognized serotype of ASF, which currently contains 24 recognized genotypes or strains. Only a couple of these strains have been identified as the cause of outbreaks outside of Africa. The strains vary greatly in their pathogenicity from causing no clinical signs with only seroconversion, and this is primarily seen with some of the African strains, to nearly 100% mortality in affected animals, which is more likely to be what we would see here. ASF shows high resistance to environmental conditions and remains infectious over a long storage time, either below 0 degrees Celsius or at 4 degrees Celsius. ASF displays a resistance to a number of physical and chemical agents that is uncharacteristic of many enveloped viruses, and the precise mechanism of this stability is not fully known. The large and complex structure of the capsid proteins and the multi-layered lipid envelope likely confer additional protection. And the lipid envelope is multi-layered as the virus is wrapped in cellular endoplasmic reticulum during assembly. The virus is particularly stable in proteinaceous material. And this information is of importance to veterinarians because it's the complexity of this virus that results in the environmental resistance, as well as the difficulty in developing a vaccination. So now we'll get into susceptible species. So ASF is lethal in all suids, including domesticated swine and European wild boar, and all ages appear to be equally susceptible. Now this particular slide depicts a situation that's specific to Africa, or what's called the sylvatic cycle. In regards to African wild swine, species include bush pigs, warthogs, giant forest hogs, and these are natural carriers of ASF and usually show no signs of the disease. And ticks also play an important role in disease transmission. Thinking a little bit closer to home, wild pig populations do exist in both Canada and the US and are derived from a combination of escaped domestic swine and European wild boar, which have been brought over to the Americas for hunting purposes and for agricultural diversification. Wild pig populations are a significant risk factor here and have also been implicated in transmission worldwide. However, the sylvatic cycle is not known to exist outside of Africa, so the specific situation involving natural carriers and tick transmission is very specific to Africa. Disease transmission to wild pigs dramatically increases the risk of creating an endemic situation in a previously ASF-free country, and this may make presumption of trade difficult or prolonged. Some provinces have designated their wild swine as pest or invasive species under provincial legislation, and in Canada, wild pig populations are most dense in Saskatchewan, Manitoba, and Alberta, with sporadic sightings in Ontario, Quebec, and BC. There are no reports of wild pigs in the Atlantic provinces or the 3 territories. So oronasal exposure is one mechanism of ASF transmission. This occurs due to direct contact with infected pigs or indirect contact with contaminated fomites and pork products, including pork products that are processed but not fully cooked. And this oronasal exposure is considered to be the primary route of transmission. In many parts of the world, ASF is considered a human-mediated disease with jumps of large distances in short periods of time, and that's that indirect transmission at work there. The other mechanism of transmission is the bite from an infected tick. And in Africa, the Ornithodoro's soft tick is part of the transmission cycle. The 2018 OIE code states that any species of Ornithodoro's ticks should be considered a potential vector or reservoir for ASF. And although the tick is a significant part of the transmission in Africa, it is not seen to be an important vector in the spread across Europe and other parts of the world. Other species of ticks could potentially be implicated, but there's still much that remains unknown. In Canada, the hard ticks that we think of most commonly are not considered to be potential vectors of ASF. And of the 8 species of soft ticks in Canada, none have yet proven to be pig biters that we know of, and all are located in the western provinces, so BC, Alberta, and Saskatchewan. In general, most soft tick species are found in warmer climates than ours. However, it is possible for certain regions, such as southern Quebec, Ontario, BC, and Alberta, to have suitable climates. Canada does continue to perform research on potential biological vectors. Of other note, the burrowing behavior of wild pigs in Africa is thought to be the reason for transmission by biological vectors, where ticks will largely attach, feed, and then fall off within minutes within the burrow. North American wild pigs demonstrate less of this behavior. They tend not to burrow, but the information on Canadian wild pigs would be considered incomplete at this time. In any case, in any outbreak of ASF in Canada, the possible role of ticks must be evaluated and tick surveillance needs assessed. So this slide shows how infection of both wild and domestic pigs is really through the same sources: direct, indirect, or vector-borne. Again, ticks are implicated as a source of infection in Africa, but not reported to be elsewhere. But other insects have been implicated as mechanical vectors in transmission. To reemphasize, pigs are infected mainly through the oronasal route, and direct transmission occurs when healthy individuals come into contact with the secretions or excretions of infected swine. Airborne spread of the agent is not a significant transmission pathway for the disease, although local airborne spread of particulate during the use of water cannon for spreading of slurry on fields, for example, is a possible method of local spread. The blood of viremic animals contains very high levels of circulating virus and can persist even after death. Blood of infected pigs can cause extensive environmental contamination via bloody diarrhea, fighting between pigs, or during necropsies. Indirect transmission through human assistance is particularly important in the spread of ASF into disease-free areas. Fomites, so humans, their clothing, footwear, vehicles, equipment, veterinary supplies, including needles, feed, and bedding, that's been contaminated with blood, urine, feces, or saliva, is the primary method of spreading ASF indirectly. Food waste infected with ASF from international flights fed to local swine was thought to have been the cause of the first outbreak of ASF outside of Africa and Portugal in 1957, and this occurred again in Brazil in 1978. And it's important for Canadian veterinarians to know that feeding international waste to pigs is banned in Canada, and the feeding of meat to pigs is also prohibited except as part of a registered feed. And this is important information that should be communicated to non-commercial pig operations or pigs kept in small holdings where food scraps may be fed. And in terms of specific risks in Canada, we think mainly of visitors bringing favorites from home that contain pork meat, and somehow that waste making its way into a pig in Canada as a possible risk for ASF transmission. So some important epidemiological elements of ASF include an average incubation period of 7 days. And now officially the OIE considers the incubation period of ASF to be 15 days with a range of 4 to 19 days. And the CFIA does use 15 days in line with the international standard. It is believed that the infectious period starts with the onset of viremia and can last up to a month or more beyond the resolution of clinical signs in surviving pigs. Viremia generally occurs from 2 to 3 days until 8 days post-exposure to the virus. And active viral shedding can occur up to 48 hours prior to the development of clinical signs, which on average do not begin until around 5 days or more after infection. Once clinical signs appear, very high quantities of virus are shed, but it's that preclinical shedding that can contribute to spread before ASF is even detected. Experimental infections in live pigs have shown ASF can be shed and transmitted to other swine for 30 to 70 or more days. And even with low virulence isolates, animals can remain infectious for 30 to 45 days. Regardless of the type of clinical presentation displayed, so acute versus chronic, morbidity rates tend to be very high due to the contagious nature of ASF and high viral shedding. Mortality rates, however, can vary dramatically from 5% to 100%, depending on the virulence of the isolate involved and the immune status of the herd. Where highly virulent strains are involved, especially in the naive populations, ASF generally has very high morbidity and mortality rates, up to 100%, regardless of the age of the pig. In these situations, acute and peracute disease is more common than other forms, although it may take days to weeks for virus to spread through the herd. And notably, it is estimated that the time from infection of one animal in the herd until ASF detection is 13 to 19 days, especially in large herds. And this was consistently reported in recent outbreaks in Asia. And this again relates to disease spread, especially in the commercial system, where significant movements can occur in that 13 to 19-day period. In regards to the pathogenesis of ASF, we know the following. ASF has a very complex pathogenesis which is only partially understood. Activated monocytes and macrophages secrete a wide range of mediators, including pro-inflammatory cytokines such as interleukin-1, interleukin-6, and tissue necrosis factor alpha. These cytokines can trigger acute phase reactions, inflammation, activation of endothelial cells, and apoptosis. As already described, the primary portal of entry is via oronasal contact or bites from an infected tick, where ticks play a role in transmission. The primary site of viral replication is monocyte and macrophages in the tonsils and lymph nodes when oronasal exposure occurs. If the exposure is by a tick bite, the virus is injected directly into the bloodstream and spreads quickly to the reticuloendothelial cells and lymphocytes, where it replicates in the cytoplasm. Virus spread is via blood or lymph to secondary replication sites, including lymph nodes, bone marrow, spleen, liver, lung, and kidney. And this is why so many different tissue types are suitable for sampling. And although not completely understood, severe disruption of the blood clotting mechanism is responsible for the resulting hemorrhagic lesions. Compared to other viruses, ASF is highly resistant to inactivation, especially in organic material. The virus can survive several months in fresh, frozen, or uncooked meat products. And the table on the right-hand side of this slide shows some of the variations in virus survival times. And the main point to emphasize is that the virus has the ability for long survival times depending on the medium. Now, a specific comment regarding manure. The literature is highly variable in regards to survival in manure, mainly due to the fact that the evaluations were done at various temperature and humidity combinations, resulting in a large range of results. The virus can be readily inactivated by lipid solvents and commercial disinfectants based on iodide and phenolic compounds and hypochlorite. Veterinarians should always check disinfectants for ASF effectiveness label claims. The virus can be inactivated in pH levels less than 3.9 or greater than 11.5, but you can see that it's stable in a very wide pH range. Cooking processes where meat is heated to 70 degrees Celsius for at least 30 minutes will also inactivate the virus, and that's the international standard. So this slide outlines the role that veterinarians have to play in relation to the material that has just been discussed. Veterinarians need to have an understanding of the disease and the transmission pathways. Biosecurity protocols are critical to mitigate the risk of introduction of ASF. Every swine veterinarian or vet that sees swine should have a conversation with swine producers and owners regarding ASF, especially review of the global situation, discussion of the risks of introduction, as well as preventative measures to mitigate the potential introduction of disease. And I would imagine that many of you have seen good examples, and maybe not so good examples, of biosecurity. But some of the things that we think about in terms of good biosecurity practices are controlling the entry of visitors, the use of detailed logs for service providers and other visitors to the farm, knowing your source of feed and being comfortable that it's a safe source of feed without contaminated materials. So now we'll move into disease recognition portion of the presentation. And this is really important because ASF is not a disease that can be diagnosed based on clinical presentation alone. Testing is always required. The following slides will review clinical and pathological signs and discuss when veterinarians should contact the CFIA. And it's really important to note that ASF will look different in small-scale versus large-scale holdings. In small-scale holdings, pig owners may report sudden death of all or several pigs, which would immediately trigger ASF suspicion. But in large-scale production systems, the disease can spread slowly, and reports from impacted countries indicated that it can take several weeks for mortalities to rise above the expected baseline when ASF enters a barn. And during that time, as we've discussed, significant spread can occur. So the question for most veterinarians in relation to ASF is, when I hear hoofbeats, when should I suspect the zebra, which is ASF, instead of the horses, which are the many endemic diseases that may mimic the signs? So let's first focus on the acute form, since this relates to what we expect to see with the currently circulating strains. There are no pathognomonic signs for ASF, but a pig with high fever and body diarrhea with elevated mortality rates in a herd should trigger a high index of suspicion. And we've been told that pen-level mortality is the best early indicator of ASF in large commercial operations based on how the disease is expected to spread. Acute forms of ASF predominate at the beginning of outbreaks in disease-free areas with mortalities in the 95 to 100% range, irrespective of age. If ASF becomes established in an area, the disease may evolve from an acute to subacute form. And chronic or subclinical forms may eventually evolve in regions where the disease becomes endemic, which is what we see in Africa. Clinical signs are variable, but with highly virulent strains, we expect to see some or all of the following: high fever, and that high fever may precede other clinical signs by a few days. Weakness or unwillingness to stand, vomiting, constipation or diarrhea, sometimes bloody, and erythema, particularly of the ears, snout, and hindquarters. Vets may observe labored breathing and coughing, as well as reproductive impacts such as abortion or stillbirths. And of course, they also may see sudden death. The clinical signs of ASF are identical to those for CSF, and laboratory diagnosis is necessary to distinguish between the two. Compared with CSF, the progression to death in the acute form of ASF tends to be more rapid. Animals can appear mild to moderately ill and then deteriorate rapidly. So now we'll review some pictures that relate to clinical and pathological presentation. So often ASF is perceived as a peracute disease with sudden high mortality, such as shown on this slide. However, as we've discussed, this is typically not the case. Most situations with a highly virulent strain show an acute form of the disease, and it's the highly virulent strain that we would be most likely to see here, given what's circulating internationally. This slide represents what is often observed first with ASF. Pigs begin to huddle early in the disease as fever develops. They can be aroused, but soon return to that huddling position. Anorexia begins at this stage, and this occurs for several days before the skin cyanosis occurs. So on this slide, the top left photo demonstrates prostration and erythema of the skin at the tips of the ears in pigs affected with ASF. The bottom right photo demonstrates erythemic to cyanotic ears that can be cold to the touch. And these signs are due to decreased blood clotting cells beginning around 48 to 72 hours post-infection. And obviously these changes would be most notable in white pigs. So on this slide, the top left photo demonstrates erythema or reddening of the skin of the hindquarters, and the bottom left photo demonstrates diffuse cutaneous hemorrhage of the hindquarter. So now we're going to move on to some postmortem images, and just a quick shout out to the National Center for Foreign Animal Disease, who provided us with the ASF gross pathological images. So this first slide demonstrates hemorrhagic parabronchial lymph nodes. You can see them down sort of the center between the lung lobes here. Now this picture depicts severely congested and edematous lungs. You can see pulmonary congestion and septal edema of the lungs, which causes prominent interlobular septa. And it's also possible to see pleural, pericardial, or peritoneal cavities containing straw-colored or blood-stained fluid, which you can see kind of oozing out of the lung tissue surrounding this image. It's also possible to see hemorrhages on the endocardial surface of the heart, depicted with these darker areas here. And we can also see hemorrhagic gastrohepatic lymph nodes, which are quite pronounced in this image. Another change that can be seen is gallbladder edema. So the gallbladder is not an organ that is routinely sampled, so vets should take any opportunity to get used to the normal look and feel of a gallbladder doing routine necropsies. This depicts subtle swelling of the gallbladder at the top and sides that could be easily missed during a necropsy. So it's this change here. So these changes obviously are much less dramatic than the other changes we've seen in other images. So this slide depicts hemorrhage of serosal surfaces in the GI tract. And I just wanted to point out that we described in the pathogenesis section how the virus can spread throughout the body. And we really see that in these slides with so many different tissues affected. So again, we have another organ affected here. You can see splenomegaly or marginal splenic infarcts. The splenomegaly can be pronounced up to 3 times the normal size, and it would appear dark and very friable and necrotic. The spleen becomes very meaty and would not ooze blood when cut. We can also see changes in the kidney. So this picture depicts hemorrhagic renal lymph nodes. And the hemorrhages in the kidney may be due to endothelial dysfunction aggravated by virus replication in endothelial cells or direct damage to endothelial cells by virus replication. And here's another example of changes in the kidney where we see fairly diffuse hemorrhage of the renal cortex. So you can see these tiny hemorrhagic areas throughout the cortical tissue. So just some key takeaways. Can you tell just by looking that these pigs have ASF? No, you cannot determine that these pigs have ASF or don't have ASF for that matter, simply by looking. Diagnostic tests are absolutely needed to be certain. So based on the clinical presentation just reviewed, what domestic diseases do we have in Canada that could mimic ASF? So actually there's quite a long list of diseases that can mimic ASF, but it does include conditions such as erysipelas, salmonellosis, septicemic pasteurellosis, and other septicemic diseases. They look very, very similar to ASF. So now we're going to do a little bit of a pop quiz here to make sure people have been paying attention. Can you identify which lesions are from animals diagnosed with African swine fever? So I'm just going to let you consider your answer for a few seconds. So the answers are B and C. Those are animals that have been diagnosed with ASF. Now, if we go back, A is an example of hemorrhagic lymph nodes in a finishing pig with salmonellosis. D is an example of mulberry heart in a nursery pig. And E is bladder tissue showing a vitamin K responsive hemorrhage. And I just wanted to pause here briefly to give a shout out to Dr. DeLay at the Animal Health Laboratory at the University of Guelph for providing us with these images seen here that are not related to African swine fever. So another question, which of these animals have a diagnosis of African swine fever? So again, I'll give you a few seconds to consider your answer. So the answer is B and E. So if we go back and look at the full set of pictures, A represents a pig with a bacterial septicemia. C was a diagnosis of porcine dermatitis and nephropathy syndrome. And D represents a sow experiencing PRRS. So we have touched on differential diagnoses in the previous slides, but I'd like to provide a little bit more detail here. So as we've mentioned, ASF and CSF can present identically, and therefore laboratory diagnostics are required to distinguish between the two. And it's just important to note that if you submit a sample to the National Center for Foreign Animal Disease for either ASF or CSF, they will simultaneously test for both diseases for suspect cases. It is a little bit different for surveillance, where we're focusing on African swine fever at the current time, but for suspect situations, both tests are tested for concurrently. So there are other reportable diseases, such as pseudorabies, which have similar clinical presentations. And there's also a number of non-reportable diseases which may have a similar clinical presentation, such as salmonella, erysipelas, PRRS, Pasteurella, and general septicemia. So recognizing the disease based on clinical presentation alone is not possible, and that's the key takeaway message. So switching gears again a little bit as we wrap up today's session, I want to circle back to roles that vets play, but I first wanted to review some relevant authorities. So the Federal Health of Animals Act has a broad range of authority, and it's important for stakeholders and partners to understand what Canadian laws provide for and how these provisions drive response actions. So in Canada, according to the Health of Animals Act, there is a reporting requirement. So any person having care or control of an animal who suspects a federally reportable disease must report this to the nearest CFIA office. And we recognize that producers do not necessarily recognize the clinical signs of these diseases, so it's often veterinarians that are called upon to make that decision. So the key take-home message here is that any veterinarian suspecting a foreign animal reportable disease is obliged to notify the CFIA district office immediately. So this slide outlines the role that veterinarians have to play in relation to the material that has been discussed today. While Canada is currently free of ASF, it's important for vets to be aware of the clinical recognition of the disease. Veterinarians are so critical to early detection because they're the boots on the ground, seeing what's happening at the farm level. So veterinarians should suspect ASF when presented with pigs with an increased mortality. So mortality rates with ASF approach 90% or higher, but note that these high mortality rates can take time. And in a large herd, you will not see those high numbers at the start of an outbreak. ASF should also be suspected when you see clinical signs that have been presented in the previous slides, or when differential diagnoses or domestic diseases have been ruled out, so you've got clinical signs that are unexplained. ASF should also be suspected when there's a presence of risk factors for the introduction of ASF, such as a history of international travel of owners or employees, or possible exposure of pigs to potentially infected product brought back from ASF-affected countries. Currently, the surveillance for ASF is mainly passive, meaning it relies on reporting of disease from veterinarians and producers. However, an active surveillance system for ASF, based on early detection, has been implemented and more activities are under development. Veterinarians may be asked to play a role in providing samples when ASF is not suspected, but could be a differential diagnosis. So in terms of important takeaways from this slide, you need to understand the disease reporting requirements for yourself and your clients. And again, any producer or veterinarian who suspects ASF must report that suspicion to the CFIA immediately. So that brings us to the end of part 1 of our ASF presentation series. Part 2 will take place next Tuesday, October 27th, and will cover disease control strategies. And the presentation will be made by Dr. Bobby Lundquist. Part 3 will take place on November 3rd, and I will present on prevention and preparedness activities, as well as do a circle back and discussion of the role of veterinarians. So I think with that, Egan, I will stop and turn things back over to you for a discussion of some questions.
Yes, thank you very much, Amy. Fantastic presentation, and certainly I think a great opportunity to ask Amy a lot of important questions about this disease, and certainly she's gathered a lot of great resources from our National Center for Foreign Animal Disease to present for you today. So just a reminder to the group, if you have questions, please put them into the chat function, and Bobby and I will scan the chat function to make sure all questions, we can get to all questions. So first question I have for you, Amy, came from a veterinarian, and the question is there legal importation of live Eurasian wild boar from Europe to North America?
So in terms of the importation of pigs, it's very, very heavily controlled by our import section. So we would allow the importation of commercial or domestic swine from very few sources around the world. I believe there's pigs allowed to be imported from the United States and a few European Union countries, possibly Australia and New Zealand, but there would not be importation of wild pigs at this point in time.
Great, thank you for that. A bunch more questions coming in, so I'll read the next one to you. What would be the rationale why the erythema in affected pigs is more expressed on the external ears and the hind part of the animal?
That's a good question. In terms of the external ear, I would say it would be directly related to sort of the closeness of the blood vessels to the surface. It's very thin tissue there, and you often see changes and bruising on the ear surface. The hind quarter, I am not sure about. It could have something to do with just sort of the dependent areas where you'd see hemorrhage collecting. But I'm not entirely sure of the specific mechanism of that particular area of the body. I don't know, Egan, do you have any knowledge on that particular distribution?
Yeah, so certainly I'm not a pathologist, but we commonly see septicemic type lesions in exactly the same areas. And so I think you nailed it, Amy. It's a relationship of small vessels and dependence, the pendulous dependenceness of the animal. So very common to see, you know, ears, feet, the lower areas of the extremities are all involved. And I think you've covered it perfectly.
Great, thanks, Egan.
Great, another question, and this is a question that I really got commonly a lot when the disease first hit Asia, but a question that's come up here too. What age group is most susceptible?
Well, based on the information that we've seen, it seems like all age groups are equally susceptible to ASF. And I know it's quite common in other diseases to see certain age groups that are more or less susceptible, but that does not seem to be the case with ASF. I mean, that's what's reported in the literature. I don't know if that is what's observed clinically in these outbreak situations. I don't know, Egan, if you have any insights from intelligence from Asia, but what we have been told and what is in the literature is that all age groups are equally susceptible.
Yeah, absolutely, Amy. That would be my observation as well, working in Asia, is all age groups are equally affected. Commonly what happens in barns with all age groups, let's say it's a farrow to finish barn, and so we have all age groups represented. The virus often starts in just one area of the barn and it moves slowly. So initially you will hear producers say it's only affecting my gilts, or it's only affecting my nursery pigs. But in the end, 8 to 10 weeks later, you know, they will note that yes, it did go everywhere, but because it moves so slow, oftentimes there's a thought that it was just affecting this age group or that age group, but in the end, it goes everywhere. Next question is around testing for ASF and CSF. What is the turnaround time for ASF and CSF testing here in Canada?
So in terms of our routine procedures for ASF and CSF testing, we would anticipate a turnaround time of 24 hours or less once the samples are obtained by the NCFAD. So depending on the situation, it could take longer to reach NCFAD if they're coming from Newfoundland or British Columbia, for example. But what we're told is 24 hours upon receipt, and it often can be even in advance of that 24-hour period. I'll just make a note that there are 5 approved CASM labs that are approved to run ASF PCR testing, as well as CSF PCR testing when given approval by the CFIA to do that. So in situations where there's expected to be a delay in diagnosis at NCFAD, we can utilize that network lab capacity. So that's sort of our initial test, is the real-time PCR. Any confirmatory testing absolutely has to happen at the NCFAD. And depending on the situation, those confirmatory test results can take a couple more days to do the additional PCR tests and sequencing. But if we need to go all the way to virus isolation, for example, those results may take up to 2 weeks to obtain, just given the complexity of that virus isolation process.
Great, a bunch more questions for you coming in. I'm going to go into the Q&A. We've got some questions emerging there as well. So, any avian carriers or spread through avian species?
That is not something I've specifically seen reported in the literature, but I mentioned in one of my slides that you can have mechanical transmission by insect vectors, for example, so not ticks, but just a mechanical transmission of blood. So I suppose you could theorize that that's also possible with avian species if they were to have blood on their claws or talons and then transmit that to another pig. I guess the question would be on sort of viral load and how much blood is actually necessary to transmit the disease, an infectious dose. So I suppose if you had a situation where you had a pig that was shedding incredibly high amounts of virus in their blood and that was picked up by an avian species, it's possible, but it's not something that we think about routinely in terms of transmission.
Great. Next question for you is around another import question. What is the regulation around importation of pigs under the pet category?
So for the purposes of pigs, there is no such thing as a pet pig for the CFIA. So anyone who wishes to import a pig has to follow the same import requirements irrespective of category. So commercial pigs, pet pigs. So for example, for the United States, if you want to bring in a pet pig, you have to undergo the same quarantine and testing requirements that a commercial shipment would need to be subject to. So key takeaway here, for the CFIA, there is no such thing as a pet pig when it comes to either importation or disease response activities. They're all treated the same.
Great, good. And I get that question asked to me a lot as well, Amy. I have a question about disease surveillance and perhaps a really good opportunity for us to put some more clarity to that. So here's the question. How will surveillance be done? How was the decision for surveillance made for this disease when surveillance for other foreign animal diseases is not done? Example, pseudorabies. So probably a really great opportunity for us to bring that back to better understanding. Yeah.
So I'll first mention that we do have an existing surveillance program called Can Swine Serve in Canada, which is surveillance for swine brucellosis and pseudorabies. And it's a serological survey that occurs in abattoirs across the country. So we are doing active surveillance in commercial populations for both pseudorabies and brucellosis. So that's my first comment on other foreign animal diseases of swine. In terms of ASF, the management of ASF has been quite a bit different in terms of our relationship with our collaborators. So I'm not sure if people are aware, but we've been managing ASF as very much a collaboration where we have provincial representation, industry representation, and federal representation at the table to make decisions around make collective decisions around certain elements of African swine fever, and that includes decisions around surveillance. So we had a multi-stakeholder working group that first came up with recommendations for the types of surveillance activities we should consider for African swine fever, and then we moved into implementation, where we're implementing activities using a risk-based approach, targeting higher risk populations, and we're implementing different activities over the course of time, again, with all partners at the table making decisions. So our first surveillance activity for African swine fever was expanding the ability for the approved CASN labs to test for ASF when ASF was not suspected but could be on a list of differential diagnoses. So that particular surveillance activity is already underway, and we are working right now to consider other activities to layer on top of that for our ASF surveillance. I'll also just put a little plug in that over the next couple of weeks, in addition to these webinars, there are some specific information sessions on CanSpot ASF, our ASF surveillance. The English webinar is happening tomorrow at 11 o'clock a.m. Ottawa time, and the French is happening the following Wednesday, again at 11 o'clock Ottawa time. So that is another opportunity for people to get a lot more insight into CanSpot ASF. I don't know, Egan, if you had anything you wanted to add from your perspective on surveillance?
No, I think you've covered it all really well. You know, you've answered the question, and the answer is yes, there is surveillance for pseudorabies ongoing. Industry has worked very close with CFIA, provincial federal governments on developing surveillance and expanding surveillance plans around ASF, and you know, really pleased to see that level of progress. This disease is being taken very seriously, and a lot has been done on the surveillance side indeed. I have more questions coming in on both sides here, Amy, so I will try to get through as many of these for you as I can. The next one is, since human actions are such a large part of the transboundary spread of ASF, do we know if there has been a change in the rate or nature of ASF spread now that human travel has been altered due to COVID-19? What's happening in regards to the importation of certain swine feeds? And I think, you know, they said supplements, but let's say ingredients to go into the diets as well.
Okay. So I think a lot of people did feel that because of the COVID-19 travel restrictions, the risk to Canada would temporarily be halted because we're not seeing that same influx of travelers and potentially travelers that are carrying prohibited materials. I think we still need to think about packages that might arrive by mail. There are still opportunities for people to send products through the mail to family members or friends in Canada. So we do have to remain vigilant with our awareness in terms of, you know, those types of risks. And I mean, we had a presentation last week from the CBSA they were describing the interceptions that the detector dogs have done over the course of the last, I believe it was 6 months. And I don't have those numbers in front of me, but there are still detections that are happening, significant amounts of materials that are still being detected by our detector dog service. So I think while the volume of travelers may be decreased, I think it doesn't mean that we don't remain vigilant and keep on with our awareness raising and all of the notifications at the airports and those types of things. So in terms of swine feed, what we have done is we have implemented some import restrictions on certain products that would be potentially used as part of swine feed. So it's plant-based feed ingredients coming in from countries that are affected with ASF. And this was a significant challenge for us, to be quite honest, because none of our existing regulatory structure allowed us to actually put import requirements in place on plant-based materials. We have a strong regulatory regime and framework for animal products, but not plant-based products that could pose a risk of animal disease introduction. So it actually was quite an interesting exercise to go through what our options were for import controls. And what we have done is declared 6 ports of entry across Canada, the marine ports that primarily accept shipments of plant-based feeds. They've been declared as a secondary control zone. And in making that declaration, we were able to put import restrictions on those products to help mitigate the risk of African swine fever. So those products now require an import permit prior to entry. There are questionnaires that need to be filled out in terms of what sort of treatments that the products have undergone either before they've been imported or after their importation, and processes that will happen within Canada. And there's specific requirements that need to be met in terms of how those products are handled to reduce cross-contamination and those sorts of things. So it's not perfect. We know that there are still products that can come in through the US and then be re-exported to Canada, but we've addressed the situation on a risk-based scale. Those products that are implicated in those import requirements are, the plant-based, the raw ingredients, as well as the meals that are associated with many of the plant-based products. They don't currently expand to supplements. I know there was a mention of supplements, because the supplements we found from a risk perspective were incredibly low. They're manufactured by companies that are sort of part of multinational conglomerates in incredibly high biosecure conditions. So the risk of ASF contamination of the supplements was far less than what we identified on a relative scale for some of those other raw ingredients or the meals.
Great, thank you. I see we are a minute past the hour. I have a lot of questions in, a lot of questions coming up, Amy. So I'll take at least two more questions here for you, and then we can take a look at the time again. So the next question is, with increased ASF awareness and given the number of domestic diseases that may mimic ASF in clinical presentation, are you seeing increased requests for testing as a diagnostic rule-out?
I would say, we were actually talking about that recently, and I would say definitely yes. Historically, we would very rarely see submissions requesting ASF or CSF testing. I would say in the last several months, I've noticed several of those requests that I see in terms of the laboratory communications. It's not extensive by any means, and I think part of our surveillance piece that we've set up with the Kazan lab is going to also address a little bit of a gap there, where I think there might have been historically some hesitation because people really didn't think it was ASF, but they'd really like to have that extra assurance. And that's what we've set up in our surveillance system to address that particular scenario. So unfortunately, I don't have any numbers to share in terms of what our surveillance system is capturing, but I do know we've had submissions in each part of the country so far under our CanSpot ASF expanded Kazan lab surveillance.
Yeah, no question that the CanSpot ASF program has garnered a lot of attention and a lot of interest, and it's great to see veterinarians utilizing that valuable tool. Perhaps the last question of the day. There are many, many more questions to come, and I think we could be here for the next hour, Amy, but are Canadian veterinarians involved in the ASF response in other countries? This has happened in the past with hog cholera and BSE, so just wondering what is occurring.
So in terms of international engagement, I would say that we don't have any CFIA staff sort of boots on the ground assisting with international response. We do have significant engagement at the diagnostic level, the laboratory level. So our NCFAD colleagues are collaborating extensively with other nations. So the US, obviously, as well as countries like Vietnam. We're trying to use some of the Vietnamese farms to validate some of our diagnostics in a field setting. I know NCFAD also does a lot of outreach in Africa in some of the endemic situations. We also have extensive involvement through various, international organizations such as the OIE and the GFTADS, the Global Framework for Transboundary Animal Diseases. There's a committee under the GFTADS for the Americas, which has established a standing group of experts for ASF for the Americas. So there's a lot of international engagement there. And we obviously have a lot of engagement in North America with Mexico and especially the US to discuss sort of the North American approach. So while we may not be sort of boots on the ground, I think we have a lot of intelligence coming from various different places and a lot of discussion happening at the international level in terms of that collective approach to ASF and how we can work together to reduce cases internationally and especially reduce the likelihood of introduction into North America.
Well, and certainly that is our goal, is to keep this virus not just out of North America, but out of our pigs as well. We are 5 minutes after the hour. Fantastic engagement, fantastic questions. I still have a very long list of questions, but perhaps a great opportunity for participants to come back in Seminar 2 and Seminar 3 and keep the discussion going. As we move towards closing here, Amy, perhaps I'll put you on the spot again one more time. Any sort of closing comments as you've listened to the different questions or reflected on your presentation that you think we should bring forward at this time?
Well, I think for me, just the fact that we had such a significant registration number indicates that people are really thinking about African swine fever. And I really want to encourage people to keep thinking about it and think about their specific roles in terms of how they can communicate information to clients, to other veterinarians, because it's really critical that we have that frontline presence in terms of our awareness so that if ASF does cross our borders, we're able to detect it quickly because if we can detect it quickly and address the situation quickly and it doesn't spread extensively, we'll be far better positioned in terms of our response, far better positioned in terms of minimizing those impacts that I discussed. So I really just want to encourage people and thank people for their interest because I think if we have that increased collective awareness, we'll be far better positioned moving forward. And I also look forward to the subsequent discussions on disease response and other preparedness activities. And I agree with you, Egan. Hopefully we'll have a chance to circle back and address some of the questions that we weren't able to get to today. And we can also talk to the CVMA about how best to facilitate responding to those outstanding questions.
Yeah, so a sincere thank you to everyone for attending today. Thank you to Dr. Amy Snow for providing this exceptional opportunity for all of us. So 2 more seminars coming up over the next few weeks. Please take the time to register. These are different seminars, new topics as we move through the ASF series. So please feel free to join the next 2 as well.